Hi, this is Umar Bashir. I will be taking you through a set of tutorials for knee radiographs for trauma. This is part 1, which is about the anatomy. I have divided this presentation into 3 components. The first part, which is this one, is about the anatomy of knee radiographs which are taken for trauma. In the second component, I will be going through a systematic evaluation of the knee radiographs. This is to ensure that all the common injuries are picked and no serious injury is missed. And in the third part, I will go through some of the commonest injuries that can be picked up on knee radiographs. Usually, 2 radiographs, an anteroposterior or AP and a lateral radiograph, are obtained in a trauma situation. Sometimes a third projection called the notch view is added. Now let's get started with the anatomy. This is the anterior posterior projection or the AP projection. We will first identify the bones. Femur, and this bone here is the patella, the tibia and the fibula. Since the fibula is on the lateral side, this is the lateral side and this is the medial, which makes it easy. If you look at the individual bones, the femur has a bulbous distal part, the lateral and the medial condyles. In between the condyles, we have the intercondylar notch. Patella is slightly hard to see, but if you look carefully, you would see that it is overlapping the condyles, and the tip often overlaps the intercondylar notch. Like the femur, the tibia flares to form the condyles, the lateral and the medial tibial condyles. In between the condyles is the intercondylar eminence. This is the area which gives attachment to the anterior and posterior cruciate ligaments. The flat part of the tibial condyles, which forms the articular surface, are known as the plateaus. So this is the lateral and this is the medial tibial plateau. We can see a part of the fibula just lateral to the tibia and a part which is overlapping it. So this is the head of the fibula and this is the shaft. Now let's look at the lateral projection. Femur, the femoral condyles, tibia, fibula and the patella. The patella lies anteriorly, so we can see that in orientation this is the anterior and this is the posterior. Again, we're looking at the condyles which are overlapping each other, but the medial condyle tends to project posteriorly. So this is the medial and this is the lateral condyle. We can see that there is a bright line here which is the roof of the intercondylar notch. Fibula, if you were to trace superiorly, we should be able to make out the head of the fibula is overlapping the tibia on the lateral projection. Additionally, we can see the intercondylar eminence, which is overlapping the medial femoral condyle on this projection. Now let us look at the soft tissues. The muscle density can be seen underneath the subcutaneous layer, and the muscles are principally the quadriceps tendon attaching to the superior pole of the patella. From the inferior pole of the patella, the infrapatellar tendon moves inferiorly to its tibial insertion. Look at this area carefully. This is the area of the suprapatellar bursa. I will pay more attention to it in the later parts of my presentation